Every patient's hospice program has three fundamental objectives: alleviate pain, minimize discomfort, and keep symptoms under control. We will go over the more common symptoms and explain the tools and resources provided to help you accomplish this. While every patient is unique, all patients will have one symptom in common: the fear of pain. The fear of pain is understandable because pain is our body's way of telling us something is amiss, so we all fear experiencing pain to some degree. The philosophy of our pain management program is that the patient is the only expert in the room when it comes to describing the pain they are experiencing. Our goal is to use the least amount of medication possible to keep each patient's pain at a bearable level and minimize the sedation and confusion that can occur with the more potent pain relievers. One of the techniques used to accomplish this is to combine some specific over-the-counter medications to achieve the same level of pain relief achieved using prescription painkillers. For example, non-steroidal anti-inflammatory drugs such as aspirin, Advil, or Aleve can, when coupled with Tylenol, accomplish the same level of pain control achieved using opiates and without many of the side effects caused by opiates, such as constipation. When pain can't be relieved purely by over-the-counter pain relievers, opiates are introduced to the pain management regimen, beginning with the lowest amount possible and still effectively alleviating the patient's pain and discomfort. When the pain-relieving effects of over-the-counter pain relievers plateau, a member of the hospice team will deliver a more potent opiate-based pain reliever. They will also guide you through the use, dosage, and schedule of administration. Patients and caregivers often fear addiction and dependence when opiates are prescribed, but this need not be a concern. Opiates are indeed addictive, but more importantly, they are the most potent and effective pain-relieving medication there is. In a hospice setting, pain management is the thing that matters most. So when the patient's condition worsens and pain becomes less tolerable, more potent painkillers are required to restore their comfort. Opiates are the only pain relievers that are effective enough to do this. Nausea and vomiting are both common symptoms and can result from numerous things, any of which can lead to a blockage in the gastrointestinal tract. For example, obstruction of bowels can result from a disease like cancer or scar tissue from a previous surgery. It can also be a side effect associated with opiates. If it is determined that nausea and vomiting are not the results of a blockage, we often rely on promethazine, Phenergan, or similar drugs to help control nausea and vomiting. Promethazine can be administered either by mouth or rectally. Your emergency kit will likely include several Phenergan suppositories to be administered every 4 to 6 hours as needed. Metoclopramide, Reglan, can also be used with Phenergan to provide more significant relief in more severe cases. The hospice team will guide and assist you in managing these symptoms if or when they arise. Constipation is common when opiates are introduced to the pain management regimen. Fortunately, in most instances, over-the-counter laxatives will overcome this symptom. Although in more severe cases, the patient may require the use of an enema. Senna, Colace, Dulcolax, and Miralax are all effective treatments for any constipation issues that may arise. A common situation occurs when oral intake of food and water is reduced to the point that there is no significant stool formation, resulting in no bowel movement. This condition is not considered constipation and does not warrant laxatives. The hospice team will assist and guide you in managing this symptom as needed. Shortness of breath is perhaps one of the most challenging symptoms to treat, and to treat effectively requires active coordination with your hospice team. Unfortunately, there is usually no simple solution to this symptom, and figuring out the best way to manage it often varies with each patient. It generally requires a combination of tools, medications, experimentation, patience, and some faith in the process, which can include a combination of any of the following: oxygen delivered by nasal cannula, In addition to its potent pain-relieving property, morphine effectively alleviates the subjective sensation of air hunger in conditions associated with shortness of breath. Controlled doses of benzodiazepines, Valium, Ativan, help relieve anxiety associated with shortness of breath. Nebulized bronchodilators on a scheduled and as-needed basis, special equipment is required. Fans and air conditioning often have a soothing effect on certain types of shortness of breath. Terminal sedation is an option when every other option has been exhausted, but only as a last resort.